I'm Casey Shaver. I'm going to be giving my presentation on eating disorders. Almost 7 years ago, I was diagnosed with EDNOS, which you'll find out what that is a little later. At the age of 10, I was diagnosed with epilepsy. So I'm finding it very interesting that neurology is becoming a reoccurring discussion in the area of eating disorders. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-4, discusses how brain imaging and genetic discoveries might be interwoven into a model of eating disorders to provide better classification and treatment. There are 3 key points I want to touch base on, and that's the different types of eating disorders, how common and severe they are, as well as treatment and recovery. Anorexia nervosa, or AN, is an eating disorder involving self-starvation to lose excessive amounts of weight. A person with anorexia is very emaciated. Bulimia nervosa, also known as BN, is an eating disorder where a person binges on large amounts of food and use self-induced vomiting and the abuse of laxatives to lose weight. It's hard to tell if a person is suffering with bulimia due to the fact they have a normal body weight. Binge eating disorder, known as BED, is where a person binges on large quantities of food. However, they do not use the extreme measures to lose weight, which leads them to being overweight or obese. And the 4th eating disorder is eating disorder not otherwise specified, also known as EDNOS. And a person with EDNOS has signs and symptoms both of anorexia and bulimia, however, have not met the full criteria to be diagnosed with one or the other. A person with EDNOS does not have the emaciated appearance all the time. However, it's clear that they're underweight. Eating disorders are more common than people think. In the United States alone, there are 30 million suffering. For females, there are 20 million with an eating disorder. Most females between the ages of 15 and 24 have been diagnosed with anorexia. There are 10 million men who suffer from an eating disorder. Males with anorexia tend to identify more closely with their mothers than their fathers. And males with anorexia have more of a feminine quality about them, both in attitude and behavior. Eating disorders do not discriminate. They can affect anybody at any age, gender, or race. However, there is an exception. Anorexia nervosa is more commonly found in non-Hispanic whites. This disease is underestimated in the category of mental illness. Most of the public, and even the person with an eating disorder, is in denial about how severe it really is. Eating disorders are a silent killer. Sudden death can occur when he or she is feeling at their best. I've known people who've been in recovery and have died due to the damage over the years. I have a mortality rate pie chart, and this has all mental disorders included in there. Anorexia has 4.0%, bulimia 3.9%, and EDNOS with 5.2%. The other 86.9% belong to all other mental disorders, including bipolar, schizophrenia, etc. But the highest percentages for mortality rate belong to eating disorders. Health consequences, signs and symptoms of anorexia, bulimia, and EDNOS all have the same consequences: low blood pressure, weakness and fatigue, osteoporosis, gastric ruptures. They also tend to grow a layer of hair called lanugo all over their body to keep it warm. And they also suffer from cardiovascular complications. The most common death is heart arrhythmia that can lead to cardiac arrest. BED has the opposite effect, such as high blood pressure and cholesterol levels, heart disease, and type 2 diabetes. However, if left untreated, all 4 of these eating disorders can result into the same outcome, which is death. It's hard for people with eating disorders to get into a treatment facility due to the insurance. Insurance companies have a lot of requirements that people with eating disorders have to meet. Insurance companies categorize eating disorders as a behavioral illness, therefore they refuse to pay any mental health costs. However, they will pay for a treatment facility that is in the sufferer's jurisdiction. Insurance will only cover for treatment if it's considered a hospital where the potential patient will be admitted into an inpatient unit. Insurance makes it very clear that they will only cover for 30 days. However, depending on the patient's medical results and progress, their policy could change. Insurance companies are very strict about covering people's treatment for eating disorders due to the fact that the sufferer has usually been in and out of multiple facilities before. Once insurance has agreed to cover the 30 days, the sufferer has picked a facility that is legally a hospital, the patient will begin an assessment which is given by their potential therapist, If it'll be over the phone if out of state, and it'll last for about 30 minutes. And based upon the information that is given, the therapist will diagnose them with a proper eating disorder. So by the time they get to treatment, they will already kind of have a plan of their treatment. Treatment is 100% necessary for a person with an eating disorder to recover. There are strictly female facilities and strictly male facilities. There's never co-ed. Treatment for an eating disorder is some form of psychotherapy or psychological therapy, coupled with careful attention to medical and nutritional needs during the refeeding process. Treatment options may vary. Even though the minimum amount of time spent in a facility is 30 days, a patient can stay as long as needed. However, if insurance does run out and they cannot pay out of pocket, they are forced to leave, which means they will have to continue their treatment with an outpatient team. Most professionals agree, however long a person has had his or her eating disorder, it will take at least that long to fully recover. If a person has never had an eating disorder personally, it is understandable that he or she will never fully have the knowledge of this disease. I also had to qualify for the treatment that I needed when I was diagnosed with EDNOS. My concerns are that the ramification eating disorder sufferers have to meet will never change. Therefore, they will always have to qualify for the treatment that is so necessary. Just because a doctor has a piece of paper that says PhD does not mean they have enough knowledge about this disease to understand it, let alone cure it. And that's why I think it's very important for people with a prior history of eating disorders to get involved in the medical profession somehow and specialize in treating eating disorders. I think we would have a therapeutic advantage, and the outcome of successful treatments and recovery could potentially change the statistics.
When someone in your family has an eating disorder, it disrupts the unity of the whole family. Parents fight about what's right and wrong, about what to do for that individual, but siblings fight amongst each other too because they don't feel like the person with the eating disorder has to follow rules, because they do have behavioral problems where sometimes they're disrespectful or come across very angry or mean, and so they feel like that person is disrespectful to everyone. So there's no solution to the problem, and they tend to dwell on how to fix a person and how to fix the eating disorder and give advice, but really it has to come within that individual to find that change. It still puts everybody on edge to have to deal with an eating disorder, because we love the individual so much. We just want to make them see things our way, and we really can't. So I think that's when we start to argue with one another, when we all think our way is better than anybody else's. And sometimes that's where a problem lies, and we all have to talk to each other basically and just say, well, remember, this is not about us. This is about the person that we love. So we try to adjust, and that's what makes us get better.
Knowing what I know now, some things I would tell friends and family members to look out for are drastic changes in personality or behavior. So things like usually social person being really withdrawn or not participating in family events, staying isolated in their room, or like disappearing after dinner, wearing oversized clothing, or getting involved in other addictive behaviors such as drugs, alcohol, or self-harm. What I really want people to know is that no matter how small the change might seem in the person's personality or behavior, it's always worth bringing it up, because it could open the lines to communication and save a life and save your family.
Having a sibling with an eating disorder is very difficult because you always want to try to help them. You always want to make sure that you say the right thing, but sometimes you just don't know what the right thing is because they can have a different mood or a different reaction to what you're going to say. But it's really difficult because it can be someone that you've been really close with your whole life, but when something like this happens, it just changes how everything is. You don't know how to word things, and you just want to make it better, but there's really nothing that you can do to help them unless they want to be helped. So it just makes it difficult on your part, because again, you don't want to ruin the relationship that you've had in the past, but you don't want to make it any worse. And so just being in that situation is very difficult in itself. I see some differences. There's a lot of being withdrawn and, just being more open to the family and being able to discuss things more easily. I think that really helped after treatment. Being able to talk about what they're feeling or what it's like living with an eating disorder so we can better understand. I don't think that we'll ever fully understand, but it makes it easier to talk things through, help them through difficult times. And when we're being told, okay, well, I'm having a bad day today, well, it's easier to help them because you know what's going on and you know what things work at the treatment center that can help be used here to help them and to things like that. But it doesn't make it any easier. It's just you're more knowledgeable about it.
I decided that I needed to really pursue my recovery, even though it had been 10 years that I was like surviving with an eating disorder and being pretty successful in my career and my schooling and all of that. It just kept coming back to the same point where I was unhappy with how I felt, with how I looked, with the direction my life was going in. And ultimately it got so bad that I didn't even want to live anymore, because you can't just maintain an eating disorder for that long. It will always end up getting worse. It'll always end up destroying you physically or emotionally. And I hit rock bottom. I hit the point where I couldn't do it anymore. The recovery process for me involved taking a big step in the beginning. I went to Utah to the Center for Change for 2.5 months. That was mostly because there was no way I could get myself started on the recovery process alone. I was not able to start eating. I was not able to start thinking straight and really deciding why I wanted recovery. Once I did 2.5 months there, I was in a really good place, but I had to come back to Baltimore and start doing outpatient therapy. So that looked like going to a therapist once a week, going to a nutritionist once a week. But in truth, that was not a good idea, straight from a residential facility. I ended up going back into treatment for a month. And then once I got out of there, I stepped it down a lot slower. So instead of going to outpatient, I first did IOP, which is intensive outpatient. So several hours a day, 3 times a week. And then I was able to step it down. Because the recovery process is not a short-term thing. It's not a one-time decision. It is just something that continues, and you have to keep working at it if you want to stay in recovery. So what I would say to other people who are trying to recover from an eating disorder is you need to figure out why you want to recover. And it cannot just be for other people. You can't do it to please a spouse or a boyfriend, girlfriend, parents, children. It has to be an internal motivation. Because if it is for somebody else, things change. That's not going to last. Ultimately, you'll feel resentful that you're doing it for them and you'll want to go back to your eating disorder. So you need to find that internal motivation and you need to stick with it every day, all day. Because eating disorder recovery is not a simple process. It is a constant redecision of choosing recovery over sickness. But if you can stick with it, it'll be worth it.